In this lecture, we'll look at bioactive substances and integrative care. So looking at integrative medicine, so focuses on healing-oriented medicine that considers the whole person, including body, mind, and spirit, and includes both conventional and alternative therapies. And so the scope of care includes wellness and prevention, and less invasive approaches to illness when they do occur. Integrative care involves critically evaluating all medical and healing approaches. So looking at complementary and alternative medicine, so considered not a customary part of conventional medicine and includes treatments such as acupuncture, meditation, naturopathy, and chiropractic care. And approximately 38% of adults have used complementary and alternative medicine in the last 12 months, according to the CDC. And so what we're focusing on is looking at these holistic therapies, is looking at the healing force of nature being our underlying precept, with many herbal remedies, right, having a long history of use, some being recorded as up to 5,000 years old. And the idea is so that integrative medicine combines complementary and alternative medicine with conventional approaches. So in essence, what we're doing is we're taking the best of both worlds that work and then combining them right into one treatment plan. So looking at functional medicine, so this includes some components of complementary and alternative medicine. And so this shifts the disease-centered focus of traditional medical practice to a more patient-centered approach. And the goal is to evaluate the whole person rather than individual symptoms. And so the idea, right, this underlying principle being that diet, nutrition, and exercise are considered best medical practice alongside adequate sleep, healthy relationships, and a positive mind-body belief system. So in essence, we want to do all of those baseline things to maintain our health and then deal with issues with health, which should really be aberrations or things that are abnormal in our health. So a functional nutrition assessment, so this is being used more frequently as part of a complete health evaluation. And so functional nutrition assessment is used by providers to help seek integrative care as an approach to reducing cost, as well as enhancing patient satisfaction. And so diet therapy and dietary supplementation are methods commonly practiced in the context of complementary and alternative medicine, as well as integrative and functional medicine. And so this is things like the Dean Ornish diet, the Zone diet, Atkins, Pritikin, macrobiotic, vegetarian diets, right? These are all under the complementary and alternative medicine modalities. And so here we can see our functional medicine matrix model. And so again, you can see all of the different components that we're looking at, which again, we're trying to identify the actual cause of the problem. So not just treating the symptoms, but again, we see this looking at these antecedents and then what they trigger. So again, the idea is that there's a psychological component, there's a hormone component, there's a digestive component, and we want to then identify the issues and then of course correct or remove them from the diet or from the patient's environment. So looking more at complementary and alternative medicine, so these approaches are often considered when conventional therapies or diagnostic workups are not deemed effective by the patient, when the complementary and alternative medicine approaches have been shown to be effective, or when the approaches are supported by significant historical evidence or efficacy, and or conventional treatments prove to be too costly. And so here we can see now, again, you have to look at the definitions, and so again, we're going with what the government defines. So when you see the 10 most common complementary and alternative medicine therapies, so this is everything from, you see the most commonly things like natural products, to deep breathing, meditation, chiropractic and osteopathic care, massage, yoga, diet-based therapies, progressive relaxation, guided imagery, and homeopathic treatments. So, and again, realizing, and we'll talk more about homeopathic treatments because the government has a different definition. So again, just make sure that you're looking at the definitions clearly when you see these types of explanations or numbers. And so here we can see what it's most commonly sought for. So this is what types of disease states or injuries or illnesses that people are seeking complementary and alternative medicine for. This is things like back pain, neck pain, joint pain, arthritis, anxiety, hypercholesterolemia, head or chest cold, other musculoskeletal issues, severe headaches or migraines, and insomnia. So in 1992, the NIH founded the Office of Alternative Medicine of the National Institutes of Health. And so what we've learned over time, of course, is that especially given their historical context and efficacy, is that some of these treatments do work. Right now, some of these are quackery, but some of them do work. And so what we'd like to do then is identify the ones that work, and if they work, give patients access to them and or recommend them. So In 1992, they founded this research unit that's supposed to explore complementary and alternative healing practices scientifically using research, training, outreach, and integration. So again, we run the clinical trials, we prove the technique works, and then we distribute that information to medical professionals so they can begin incorporating it into practice. The other thing it allows for is medical reimbursement of complementary and alternative medicine. So again, for example, once we prove acupuncture works for tension headaches, insurance will now cover acupuncture for tension headaches as opposed to patients having to pay out of pocket. And so medical and nutrition training, again, can be incorporated into their curriculum going forward. So again, what happens is that once we prove the technique works, it can be then added to med school curriculums so that, again, we're not having to try and teach people after the fact, right? But they're actually getting that training and that information while they're in medical or nursing school. So looking at naturopathy, so this is based on the concept of the healing force of nature, emphasizes the prevention of disease and the maintenance of health. It's still focused on, right, doing no harm to someone, and again, that sometimes has some different definitions, because I love when the doctor says, well, when I do this, it hurts, and they say, well, don't do that. And you're like, but I need to for my life, right? So is that more harmful than not doing it? So avoids therapies that weakens the body's innate ability to self-heal or that take over a function of the body. Diagnosis and treatment is based on natural laws, with nutrition and dietary supplements routinely being used, and this does require licensure in most states. And so you'll see, so it depends on the state, again, with differing levels of regulation. So looking at chiropractic care, so again, looking at the body's ability to heal itself and the practitioner's role being to assist the body in doing so. So you will see somebody has a doctorate of chiropractic, but they do not prescribe drugs. So instead, they're focused on manual manipulations, and so specifically, they're focused on subluxations, which are musculoskeletal problems that lead to an interference with a proper function of the nervous system. And so this involves manual manipulation of the body, including the most famous thing that you see, which is spinal adjustment and muscle work. And again, chiropractors have to be licensed in all 50 states. It is a rigorous 4-year program from an accredited college, and does require, right, a national board exam. So homeopathy is based on the belief that you treat like with like, commonly known as the law of similars. And homeopathic medicines are extremely diluted and mixed vigorously, known as succussion, and so the idea is that you're having to use the least amount possible to evoke an effect. And so the goal is to select the remedy that will bring about a sense of well-being on all levels, physical, mental, and emotional. And the clinical evidence or efficacy of homeopathy is highly contradictory, right? The biggest concern being that a lot of times if you're testing these preparations that are actually done correctly, right, is that commonly the lab test will actually show us that it's so diluted it's almost at undetectable levels, in which case, right, it's not really able to have the desired effect. Now, ideally, right, and that's part of one of the principles, is that you want to use as little medication, or in this case, right, this preparation as possible. So conceptually, I get it, right, but that's the concern then, is that there still has to be enough of the active ingredient to evoke an effect. Now, I do want you to realize is that the government has recently updated its labeling regulations, and so you will see quote-unquote homeopathic treatments in the pharmacy, etc. But the government has decided that basically anything that is not your standard FDA-approved conventional treatment is a homeopathic treatment. But that's not actually practicing homeopathy, right? So just realize what the government says is a homeopathic treatment. So for example, using peppermint oil for GI upset, that's not homeopathic treatments, but the government calls it a homeopathic treatment for labeling purposes. So please just don't get that mixed up. Looking at traditional Oriental medicine, so here we're looking at the concept of energy or qi being the balancing force of the body. And so the body does consist, right, in this system of 4 substances, which is going to be blood, jing, which is essence or substance of all life, shen, which is the spirit, and fluids. And so nutrition therapy may involve food as nutrition, tonics, or as a medicine, absence of food such as fasting, or providing foods based on taste, so sweet, sour, bitter, spicy, or salty, or based on their properties, right, being hot, cold, or plain, which again is not based on temperature. And again, to bring balance back and to regulate yin and yang and qi and the blood, and then also focusing on the meridians, being the invisible channels that carry qi and blood throughout the body and act as the energetic fields. Looking at acupuncture, so this is the use of thin needles inserted to the points or meridians to stimulate the body's qi or vital energy. And so then we also have moxibustion, which is the application of heat along the meridian acupuncture points for the purposes of affecting qi and blood, so as to balance the substances and organs. And it's used to treat disharmony in the body, which is believed to lead to disease processes. Looking at massage therapy or body work. So the philosophy is that there's healing that occurs through the action of touch. And so massage therapy has grown quite a bit over the last several decades, with key principles, right, focused on increasing blood circulation, moving lymphatic tissue to remove waste and release toxins, calming of the spirit, enhancing physiological functions of the body system, and improving musculoskeletal function. And so, right, one of the biggest things probably is that people are probably familiar with from a medical standpoint is medical massage for lymphedema, which is so you'll see severe swelling in the lower legs. And so there actually is a massage technique, right, where you can lift the legs and actually push the fluid back towards the subclavian vein and actually decrease swelling. And of course, right, massage is also widely used to reduce stress and increase energy. Looking at supplements. So there's limited information on the effects of dietary supplements taken concurrently with prescriptions and other OTC medications. And so that's kind of the big concern, is that there's a synergistic effect, as again, some of these do work and some of these do work really well. So then when you combine them with drugs, they can work a little too well. And so there was a position paper back in 2009 when we were still the ADA that called on RDs to be the first source of information on nutrient supplementation, i.e. this is something that dietitians should be trained in and made aware of. About 1/3 of adults use a multivitamin and mineral supplement, and the most common non-vitamin, non-mineral supplements are fish oil, glucosamine, echinacea, flaxseed, and ginseng. So supplements are defined by the Dietary Supplement Health and Education Act as products intended to supplement the diet that contains one or more of the following ingredients, and that's vitamins, minerals, herbs or other botanicals, amino acids, concentrates, metabolites, constituents, or extracts. These can be in pill, capsule, tablet, or liquid form, and should be labeled as a dietary supplement with a dietary supplement facts label, which looks very similar to a food label, but they're not technically the same requirements. So here you can see the supplement facts label. Again, similarly, we have a serving size, our calories, our fat, right? And then again, though, looking at, so our daily values are a little bit different. So again, like if it has a macronutrient component, then you're going to have daily values, but otherwise you won't. Again, your ingredients are still listed in order of weight, etc. And so looking at if something is a supplement or if it falls under other regulations, here you can see is what it's based on is its intended use. So you can see, right, what makes it a food versus a drug versus a cosmetic versus a supplement versus a functional food. And so again, it seems very similar. Some of them do have very similar criteria, but it has to do with some legal minutia. So looking at botanicals, so these are plants that are used for medicinal purposes, and this can include plants' leaves, flowers, stems, rhizomes, or roots, with a wide variety of formulation including teas, infusions, decoctions, extracts, pills, and oils. And topical applications, though, in the forms of creams or oils are not classified as supplements under the current regulatory definition. And so this is why you'll see, you may see things like arnica in lotion and things like that. And again, conceptually it's the same, which is you're still looking for like that anti-inflammatory property, but it has to do more with the labeling and legal definition, which again more has to do with regulation than really dietitians themselves. So looking at phytotherapy, so the science of using plant-based medicines to prevent or treat illness. And so the Office of Dietary Supplements works with organizations and experts to develop a database of supplements that are being used in the U.S. And the database provides specific information on over 4,000 supplements, with information being linked to PubMed, allowing clinicians to access peer-reviewed information on its use in human trials, adverse events, and information regarding the mechanism of action. So according to, there's a study by Archer, 2005, reports show the use of dietary supplements increases with age, white race, and female gender. And so it's highest amongst those that are in the best state of health, and most frequently taken by those with a BMI of less than 25 who are non-smokers, physically active, report good health, adhere to a healthy diet, and use food labels in making food choices, and is also higher among those with higher education and higher incomes. So maybe a pro, maybe a con, right, depending on how you look at it, which is the people that are taking supplements are really the people that don't need them because they're already doing everything right, right? So if the idea is that a supplement is to supplement or correct a deficiency or increase the amount of something in the diet, right? But these are the people who are already doing everything right. Whereas normally, right, when we looked at supplements, especially from a historical standpoint, we're supplementing people because they're deficient in something. But currently, supplement use doesn't reflect that. Instead, the people that are taking supplements are not having those deficiencies, right? They already are getting the nutrients they need from other good health choices. So from Ernst 2005, so the most common herbal products include St. John's wort, echinacea, garlic, saw palmetto, ginkgo biloba, ginseng, soy, valerian root, cranberry, and black cohosh. Herbals are often taken intermittently to treat specific healthcare conditions, and so there is a table in the book if you want to look at some of the common dietary supplements and related information. So as we discussed, right, dietary supplementation is highest amongst those at lowest risk for nutrient deficiency. And so for those that are at risk that can really benefit from supplements, right, especially because they're missing specific nutrients in their diet, right, we're really looking at the elderly, those with lower socioeconomic status, those that are on calorie or fat restricted diets, pregnant and lactation, chronic illness, and depending on certain lifestyle choices, so for example, alcohol use, tobacco use, etc. So routine use of multivitamin and mineral supplement is not an appropriate recommendation to ensure dietary adequacy. So again, we want to focus on behaviors with patients, right? We want them to improve their dietary intake. Now again, that's not to say that supplements aren't beneficial, they can't help bridge the gap. But again, the idea is not that you can just eat all the Cheetos and McDonald's you want as long as you take a vitamin, right? We still want to improve dietary quality. Now there's insufficient evidence to show that multivitamin and mineral supplements reduce the risk for certain diseases. Now again, you will see, so for example, we do recommend, for example, if a patient's taking statins, we recommend that they supplement CoQ10, right? So for specific disease states, there are specific supplement recommendations, but not multis. Now it is standard practice again in some instances, such as women during childbearing age and pregnancy, again because of culture and other dietary issues with things like iron and folic acid. Again, if we could significantly improve the quality of people's diets, right, if women would eat more meat in general, get better quality sources of iron, then it may not be a concern, but again, till we change those issues, supplements are a good bridge. So looking at dietary supplementation regulation, so again, botanicals being classified as dietary supplements in 1994, so again, then plants got brought into supplements as well. And there's a variety of labeling approaches that are used by the supplement industry to market supplements, and so there's different types of quote-unquote claims, and so these statements are regulated in not what they say per se, but how they say it. So you have health claims, which is a written claim on the label that has two components, which is the substance and the disease or health-related condition. So this is the supplement and heart disease, or this is the supplement and kidney disease. We also have qualified health claims, and so these are label health claims based on emerging scientific evidence that's been reviewed by the FDA, that's approved for use on a food or dietary supplement label. My favorite is they have one of these for, so you may have seen these on like different nut mixes or on snack mixes, and so it says, supportive but not conclusive research shows that eating 1.5 ounces per day of macadamia nuts as part of a diet low in saturated fat and cholesterol and not resulting in increased intake of saturated fat or calories may reduce the risk of coronary heart disease. See nutrition information for fat and calorie content. And so, for example, that is a qualified health claim for macadamia nuts, which is a whole lot of, well, but not this and not that and maybe this and maybe that. That's a qualified health claim. Now we also have structure function claims. These include the physiological effects of a product, but no claims about prevention or cure of a specific condition can be made. So potential for inappropriate use is these statements, right? This is the whole not evaluated by the FDA. So for example, I can't say it prevents heart disease, but I can say it improves blood flow to the heart. Or for example, I can't say that fish oils prevent stroke, but I can say that fish oils, right, thin the blood. So again, I'm not actually saying anything specific. I didn't say it would stop you from having a stroke. I didn't say it would stop you from having a coronary, a coronary blockage, etc. I just said it thins the blood. You let the consumer make the leap and go, oh, well, that's a stroke. whereas it may not actually be proven or shown to be affecting that. Now, the International Food Information Council report suggests that consumers cannot distinguish between qualified from unqualified health claims, and they actually prefer structure function claims for their positive focus and brevity, aka consumers have such poor health literacy and science literacy, they'd rather see improved heart flow, blood flow to the heart, rather than does this actually work on a disease? What's the actual science backing this up? That's too much science. I don't want to read that. Now, you'll also see that supplements, right, there's been a big focus on good manufacturing practices, which is how the supplements are made, with government requirements for specifications for identity, purity, quality, strength, and composition, which is the government doesn't really care what you make, right, with your supplements. You can do whatever you want as long as you don't lie about it. That's the one thing that will get you in big trouble for supplements, which is if I said this contains 500 grams of valerian root, there better be 500 grams of valerian root in this package. If there's only 450, you're in trouble. I don't care if valerian root works or not. The FDA does not care. What they care about is if you said there was 500 in there, there better be 500. That's all they care about. Now you have the Codex Alimentarius Commission. So this is created by the UN, World Health Organization, and Food and Agriculture Organization to ensure fair practices in international food trade, right, with over 180 countries participating. Again, especially with a big focus on supplements from a botanical nature. So again, we want to make sure that we're not mowing down the rainforest, right, to grow some botanical that Dr. Oz has pitched. And so looking at the assessment of dietary supplement use, so healthcare providers need to be aware that patients often do not inform them of their use of botanicals or other dietary supplements. And healthcare providers must inquire about the use of these supplements. And they want to just make sure that they're approaching their patients in an open, non-judgmental manner. Again, I don't really care so much as the fact that I need good quality information to make choices about, right, if we're talking to the doctor about your medication dose, and right, if you're taking red yeast rice and statins, right, that has a synergistic effect, your blood can get too thin and you can have a hemorrhagic stroke and bleed out. Again, I don't really care that you're taking red yeast rice. I need that information, though, so that we're all making informed decisions and making sure that your doctor is aware. And we want to encourage patients to bring these supplements to the clinic for evaluation, again, so we can see not only the active ingredient, but the dosage, are there any other excipients, is there anything else in this blend, etc. There is some good information on page 200 in your book that takes a look at, again, so the types of questions you might want to ask, as well as drugs that are known to affect clotting. And when I say drugs, I should apologize. When I say supplements that either by their own action or their interaction with drugs affect clotting and have to be discontinued before surgery. So looking at some practice questions. So number one, healthcare practitioners should ask their clients about their use of, and this is answer choice D, all of the above. That is prescribed medications, over-the-counter medications, as well as supplements and botanicals. Number two, integrative medicine refers to, and this is answer choice B, the combined use of conventional and complementary and alternative medicine. And number three, health claims on dietary supplements are regulated by, and this is answer choice C, the Food and Drug Administration, or the FDA. Thank you, and I look forward to your questions.